The dentist's drill is on its way to becoming a dust collector these days as cavities in children become more rare. One reason is the use of tooth sealant, which prevent cavities on the biting surfaces of young teeth. CNN medical correspondent Gary Schweitzer has details.
You feel all right?
It's another one of those why didn't they have that when we were kids developments. Tooth sealants, in the opinion of many dentists, are foolproof in preventing cavities.
Now we're finding that with the use of sealants, along with the use of fluorides, we have many children who don't have any cavities at all.
Here's how it works. A mild acid conditions the tooth to accept the sealant material. The liquid rosins are mixed, then the plastic is applied and allowed to harden. That's the critical step, because if the freshly applied plastic is contaminated or gets wet, it won't bond and the sealant will come off. In 20 to 30 minutes, an entire mouth can be done. Timing is important. Dentists try to get the 6-year and 12-year molars soon after they erupt.
When the teeth first come in, they're most susceptible to dental caries. Within usually, say, 2 or 3 or 4 years, the teeth that first come in will probably have developed dental caries of the grooves and fissures. So that's, of course, the critical time for getting the plastic coating onto the teeth.
The sealants are applied only to permanent teeth with no cavities or fillings, and only on the biting surfaces where most of today's cavities occur. That's a shift from a generation ago when many cavities occurred on the smooth surfaces of the teeth or between the teeth. Fluoride has stopped that. So with fluoride, sealants, and good brushing and flossing, dentists are drilling less, and neither they nor patients mind it.
Now, if a dentist drills into the tooth, no matter how good the dentist is, it still weakens the tooth a little bit. So let's say a filling would last, say, 20 years. If it were placed in an 8-year-old child, the child's still only in their mid to late 20s when that happens. The next dentist, of course, has to make the hole for the tooth a little bit bigger, and then the next filling may not last quite as long.
You always knew there had to be a better way. About 10 years' experience with the sealants show 75% will stay in place at least that long. So at the very least, the drill is being postponed, if not shelved entirely.
The Ohio Department of Health has sent dental professionals out into underserved areas around the state with only portable sealant kits, not with a lot of high-tech paraphernalia. In that sense, it's become like a dental immunization campaign against tooth decay. Gary Schweitzer, CNN, Cleveland.